Dr. Dhakal, really quickly, you've got an interesting product, the care home service. You ended up launching it in Nepal. I'm sure you tried to go to a few different insurers and tie up with them, right, for chronic disease management programs. What happened? What was the interaction like there? Have they signed up?
Well, I mean, Nepal's very, it's a very poor country, frankly. I mean, but the insurance market, especially in the developing world, is very slow on adapting home healthcare products as a enabler. Recently, I was in Istanbul and I was sharing a panel with Allianz CEO. Allianz, they call it Sigorta. So they have an innovation team, and I shared my, because they wanted to talk more about it, know more about it, like I'm sitting with him and we're talking really warm. It's like they understand the bandwidth because it protects the interest of dollar value. I mean, whoever the payer is, it doesn't matter. But at the end of the game, I mean, what we've been able to convince, at least in developing world, is there is a value for individual payers' protection. What does it mean? That people who doesn't have to go to the hospital or who can benefit not going to the hospital can actually benefit better with staying in home by 3 times protecting their money. And it is as profound. I mean, you don't have to have an insurance. It's just like if you protect money of his, or it's his or yours, it doesn't matter at the end of the day. It is basically protecting the value, and that matters most. I mean, that's the very important value that we probably miss out usually designing a business. So for health at home, what we do in Nepal, or for example, if we do in somewhere where it is insurance matured, or for example, if we get an opportunity to do with the NHS in UK, our interest is profoundly based on protecting that dollar, and it works well. So, I mean, some of the insurance payers, like for example, we do sometimes expat clients services. They pay it easily. They're very welcoming. And sometimes we also have Nepalese people who are insured in a standard insurance like MetLife and other things. We pay, and we are actually signed up with 7 insurance companies recently. This is like a 1-year development because insurance has boomed in Nepal as like new financial market. And they have signed up us for doing a preventive checkup. Like they send us in a home as a privileged client and we do it. So it's very nice process. I think 80% of the healthcare dollar value business will be in home. What James said is actually, I totally agree. And from where we come from, the knowledge base of healthcare, where we miss out most of the things is protecting that, every penny or every dollar. That will be important.
Perfect.
Yeah.
Thank you.